Douglas pouch, first question. Just find the urinary bladder, point behind it. Oh, actually, this is a female, so it's the uterus. This is a female. Be careful. If it's the female cadaver, then you go posterior to the uterus. If it's a male cadaver, you go posterior to the urinary bladder. It's just a difference. So this is the Douglas pouch. And the retios space. I'm hearing silence. It's in front of it, so it's between pubicus symphysis pubicus and the anterior of, in this case, it's the uterus. So,
And not the bladder.
well, you could also say the bladder if you want to make it a smaller space, but I would also stick to the uterus part.
Okay.
Can you show again what is the second, not the Douglas one?
The retios?
Yeah.
Here. You just find pubicus symphysis and just point behind
The
it.
Douglas, I can't see. The Douglas where?
It's behind the uterus.
Behind it. Okay.
And in male it would be behind the bladder.
Yes, behind the bladder and anterior to the bladder. Here it's behind the uterus, and you can go anterior to the bladder because it's safer. The closer you go to the pubicus symphysis, the more correct, the obvious you are. So the branches of the arteries, arteria iliaca communis will give two branches, arteria iliaca externa and interna. The externa ones are easy, and epigastrica inferior. Okay, the ones that we need to discuss are arteria iliaca interna. The branches, in order.
Arteria umbilicalis.
Anterior triangle, posterior triangle.
Because
Sorry?
we cannot see anything like this.
Okay, I'll explain it once, and then you'll go a little bit to the back so they can come. Okay, so yeah.
With you
Okay.
and then we
Okay.
switch on the other one again.
So
Everybody can see.
yes, arteria umbilicalis is the first one. It's basically a terminated artery. It doesn't function anymore, let's say. It's continued by which ligament? Ligamentum umbilicalis medialis in plica umbilicalis medialis. So the trajectory would look something like this. Now, in this case, let's try to find it. I think this is it. This is the ligament would go up again, but it should be a little bit more superficial.
Which one? Can you show me?
Well, at the first branch, I don't see it. It's
Maybe
quite
only
cut.
one person filmed.
Yeah, it makes sense.
Otherwise,
So I think
you
she's
have
gonna
your
yeah, I think
five
you have the best view.
mobile phones here and nobody else.
Okay, you have the best view, I would say.
Okay, so the first one, arteria umbilicalis, would look something like this. Will be continued as a ligament, ligamentum umbilicalis medialis in plica umbilicalis medialis. Okay, so that's the first one. What's the second branch?
Anterior triangle.
Obturatoria, which will give two branches, anterior and posterior. The important thing is the branch that is going to form corona mortis. With what artery? Arteria epigastrica inferior. Is it the artery itself? No, it's a branch from the other artery. So arteria umbilicalis, arteria obturatoria. Then what do you have?
Vesicalis inferior.
Arteria vesicalis inferior, correct. What about the superior one? Where does it come from?
From the umbilical.
From the arteria umbilicalis. So arteria umbilicalis will give the vesicalis superior, and also in some cases vesicalis media. And in not in your script,
The interna.
that's something else. Don't mix it. So again, umbilicalis will give vesicalis superior. End of story. Second branch from the iliac is obturatoria. The third one is vesicalis inferior. Okay? Vesicalis inferior.
The third branch.
Yes. And then
Uterina.
the uterina, in this case, in case of a male, you don't have. What is the one that corresponds to it? It's vesicalis inferior, sometimes superior, but it's mostly inferior. And you know that the vesicalis superior is the superior bladder and inferior for the inferior bladder. Easy. What is the next branch after the uterina?
Medial rectum.
Rectal medial. What about the rectal inferior?
What about the vaginalis?
That's coming from the uterus.
yeah. Actually, arteria vaginalis is mentioned that it comes from arteria uterina, and more specifically from the crus, the part where it just turns transversally. But it also, in some cases, it comes directly from the iliac. So, check your cadaver. Or you can just say that it's coming from the crus part. But I would personally say it comes in both ways. It also could come directly from the iliac. So eventually, we finished up with arteria rectalis media. Then
Arteria pudenda interna.
arteria pudenda interna, which is the last branch.
No, arteria crucialis inferior is the last branch.
Sorry?
Arteria crucialis inferior.
Well, the leptalis superior and inferior, these ones are really not that important. You have also the sacralis, I think, lateralis, but these ones are less important. I want you to focus about pudente interna. Arteria pudente interna has a lot of branches, and they're vascularizing the extragenital organs and the perineum. What is the terminal branch? Arteria dorsalis, penis or the clitoris. This is just to know. So arteria pudente interna is another large branch that will go through.
The
Alcock channel.
channel is the channel. Then
Or, yes, Alcock channel and hiatus infrapiriformis, and gluteus superior will go through the suprahiatus piriformis. So those are the branches of the iliac interna. Also, you also basically classify them as visceral branches and as parietal branches. So the visceral branches, just to remember them at least, the visceral branches would be the umbilicalis, because it will give the vesicalis superior. It will be the vesicalis inferior. It will be the uterina. So those are the ones that are meant for the organs. And you can also have the parietal ones, which are iliolumbalis. You still have iliolumbalis. You can have, what else? Internal pudendale, that's visceral. But maybe that's too confusing, so you can just stick to the order.
Do we actually have to show them on the internal?
You cannot.
iliac?
It's mostly, I remember getting the question about the iliac interna in the exam, and I said, well, I can't really see much of them. And he said, okay, just say them in theory. So I just mentioned them in order, and that's it.
You can see them.
But you can see some of them, yes. But I'm just saying, in other cadavers, you cannot see shit. So I'm just saying.
But then if you see them, it's kind of guessing if they're in order, right?
Yeah, you can just also talk. The more you talk, the better. So if we know that this is arteria iliaca interna, we know that the umbilicalis is not at least present, at least to my eye, at the moment, because it's cut. You can say, okay, this would be the obturatoria, I would say, because there's a nerve, and I would say that's nervus obturatorius if it's coming from medial to the muscle. You see, this is nervus obturatorius, so this would be arteria obturatorius, because they're going together through canalis obturatorius, obviously. And then what is after it, arteria vesicalis inferior, which is more specifically, also you can see how it's going to the bladder here. And then you have,
but that's.
and then the uterina, which is going to the uterus right here. See it? So obturatoria, vesicalis, again, just for the camera. This is the obturatoria going with the nerve, and this is the vesicalis inferior going for the urinary bladder, and this is for the uterina. Okay?